With Straightsmile Solutions, straightsmilesolutions.com. And if you're watching this video and you don't see a title on this slide, it's because you beat me to the punch. My title slide took a little while to come in, and I really wanted to make this content quickly and get it out there. So I'm just going to chit chat. So the question that came in today is an Ask Dr. A question. They're asking how many millimeters should you get with proper elastic wear? And how many for braces, how many for aligners? And you can see my answer here is, I don't know. I mean, and by the way, neither does Google ChatGPT, because it is almost impossible to make this study. Think about this. How would you make this study? What is gonna be the biggest variable? I mean, there's a lot of variables here. This was my answer. I'm like, I don't know, there's so many variables. The vector of the elastic, the size of the teeth, the steepness of the mandibular plane angle, the strength of the elastic, the overjet, the size of the elastic, the overbite, frequency of the elastic wear. How are you gonna measure compliance? Like, until they can create an elastic that can actually measure if it's in the mouth, because they're removable and they have to be taken out at every so many hours and replaced. How much are we eating? How much are we drinking? It is impossible to make a study like this. So if you ask an orthodontist, this would be like, ask your orthodontist, ask 50 to 100, ask thousands of orthodontists. What is your opinion? Average. I would say 1/4 to 1/2 millimeter per month, but remember elastic wear is not growth, okay? It's not growth, it's tipping the occlusal plane. And if there's spaces, it's encouraging the spaces to close in a certain direction. So the goal of a class 2 elastic is AP changes to improve overjet. The goal of the class 3 elastic is AP changes when you have negative overjet. So it really depends on how you wear it and all these other things. And then there's other research that shows that aligners, because they're not hooking an elastic to an actual wire, which is stuck on every tooth, it's either being hooked on a tooth, which then has aligners over it, or it's being hooked on a wing of an aligner, which it's going to pull the aligner out and affect the tracking. Studies do show that aligners maybe aren't as effective with AP changes. If you go to this link, which I give here in this video, you can see the video I reference. Literally, I did a big deep dive, which you guys can do too, because you always ask for my references. Have fun, look up your own references. These are the keywords you can put in. Elastics or rubber bands, I would do elastics, orthodontics, braces, scholar. Same thing, that would be same thing, but with aligners, scholar. And just a few tips that I got from doing a research on those, just some things, and nowhere could I find the actual answer to this, because I knew that would be impossible to get a study. But I'd say the most common is 1/4 medium, followed by 1/4 heavy, followed by 3/16 medium, followed by 3/16 heavy. We trained in our residency at 3/16 heavy. So I usually tell you guys 3/16 heavy for braces, and I usually tell you 3/16 medium for aligners, but you have to pick the right size and diameter that works for that patient. And there's so many variables, so sometimes it's not gonna fit. You have to have multiple sizes and find the right fit, okay? So what else did I find? Force decay, which I've told you guys before, the non-latex elastics have more force decay than the latex elastics. I told you that as well. I already knew that those don't work as well. There's research on that. Also, I found that's pretty much that. And let's see. Use of class 2 elastics during the growth period didn't have adverse effects on rotation of the jaw. I don't know. I mean, there's so much content out there. You can just do your own research, use those keywords, and read every single piece of literature you find, and hopefully that'll help you. But again, the answer is, I don't know, I'm not sure, there's so much. That's why you see your patient every 4 weeks to check. And remember, some of the changes that you get is just gonna be shift. It's just gonna be AP Sunday bite shift. So how much is it gonna be? I don't know, 10, 20, 30, 40, 50%. It depends on the patient. I mean, I've definitely seen 1/2 millimeter improvement, and then I always have them go to nights only just to see if that improvement stays. And I don't tell them why I'm going to do that, because let me tell you, there are so many patients out there that they're cheater pumpkin eaters. Cheater, and I've called patients cheater pumpkin eaters before, where they are not stupid. They come in knowing that the elastics encourage them to slide their lower jaw forward, and they're just going to slide right forward for you in your chair, because guess what? When they slide forward, you say, "Good job, braces are coming off soon." They are sliding forward. This is shift, okay? And they might not even be doing it like logically. They might not even know they're doing it. They just know that that's how the elastic encourages them to shift. They shift forward, they shift for you in the chair. And guess what? Most likely when you stop the elastics and take the braces off or take the Invisalign away, it's just gonna go back to class 2, because it's not real growth changes. But yeah, you're welcome to try it. Just don't be disappointed if it doesn't work out. All right, thanks so much.